The Human Sciences Research Council has released the first ever national GBV study based on a survey of 10,012 people, of which 5,603 were women and 4,409 men from across the country. The study provides insights into GBV prevalence, risk factors and impacts across South Africa, forming a foundation for targeted solutions. For more insights on these findings, we're joined by Research Director at Human Sciences Research Council, Dr. Mpumi Zungu. Dr. Zungu, good evening. Thank you very much for joining us on the program. Now, Doctor, before we get to the contents of the report, let's start with its significance. It's the first of its kind. What was the intention behind conducting such a study?
The intention was for us to be able to tell the country what is the prevalence of gender-based violence across the country, but also look at behaviors that are putting people at risk of either perpetrating or being victims of gender-based violence. We also had an objective to look at prevalence of GBV during COVID, and also what are the determinants of gender-based violence. So all in all, it was to provide the country with data. And this really comes from the march that you will remember on the 31st of August 2021, where the women marched to the Union building. And among those demands was that we needed as a country to have data that was representative, because up to then we're really depending on outdated statistics from surveys that had been done in provinces and also data from the police. Then
to the findings. The report paints a very worrying picture, among others, when it comes to women having been physically abused or experienced physical violence at one point in their lifetime. It indicates that over 7 million women have experienced physical violence. Just take us through these findings.
Yes, we looked at prevalence of GBV for lifetime, and we also looked at recent, which is your incidence. So for lifetime, that's where most of the stats that have been shared in the media are coming from. For physical violence, which is also including sexual violence, the stats for that is 35.5%. So you can understand that if you estimate it at a population level, you're talking about over 7.8 million women who have experienced physical and or sexual violence. And for sexual violence, we found that 9.8% of women, which translates to about 2.1 million women in the country that have been subjected to sexual violence.
Honestly, a very grim picture there, Doctor. But then of that 7 million figure, it's been broken down into racial groups, most affected by this violence being Black females. Just talk us through those figures there.
Yes, Black females across all the different categories or forms of violence, we found that they were significantly affected by gender-based violence. So if you look at physical violence, Black women were the ones that were significantly affected compared to other race groups. When you look at sexual violence, we saw the same picture. When we looked at intimate partner violence and looked at all the different forms, from physical violence, sexual violence, economic violence, emotional violence, and also psychological violence, we found that in the majority of cases, it was Black women that were affected. We are not able to provide a breakdown really with all the other races because the numbers didn't allow us to go to that detail. So what we did, we then grouped the two groups, and we are only talking about areas where this is significant. So when you hear that we're talking about Black women, it's where all these factors were significant. And in this case, across all forms of violence, Black women were at risk.
Then to the relationship status, it's been revealed that lifetime physical violence is significantly higher among women who are cohabitating. Just talk us through this.
This is a really new finding. I've been reading a lot around gender-based violence and has been working in the area. And this is the first time that we are noticing this status, this marital status, you know, where, or relationship status, let me call it relationship status, where we are seeing that women who are cohabiting with a partner, but they're not married, again, you see it across. But the interesting thing is that it's not only women, it's also men. For perpetration, when you look at perpetration, this relationship status was significant also across all forms of violence that we studied.
Those that would have been married would have experienced less physical violence in that respect. Was there any other link to this or explanation that you could establish as to why specifically those who would be cohabiting would be women that experience more physical violence?
It's one of those research questions that we need to do more work around. We have the data, and I think we will be able to do a bit of comparison between the two groups, those that are married and those that are not married and cohabiting, single, and so on, and see what are the differences. But beyond that, I think it would be important for us to conduct more qualitative studies where we do interviews, where we talk to people, where we sit down and be able to delve deeper to understand what are these issues that are happening in this relationship where people are cohabiting but they are not married.
There was also another interesting finding. The study found that mental health crisis facing men is driving up the gender-based violence rates. Just unpack that for us.
So if you look at the factors that associated with gender-based violence, for men, we found that it is drinking in a category that is called hazardous drinking, which means that the person is drinking in a way that puts them and other people at risk. So that was one of the factors that was associated with perpetration of gender-based violence. Okay. And when it comes to mental health, we also noticed that the men who reported more incidents of perpetrating violence, they also were at risk of clinical depression. Child trauma was another important factor that came out for men. Being bullied or bullying another person was also significant. Also life satisfaction. Men who had a lower life satisfaction score also were seen in those, having those factors that are associated with a perpetration of gender-based violence. So if we're going to intervene, we really need to look holistically at the issues of mental health, while we are also looking at the issues, you know, societal issues, individual issues, and also looking at the issues of trauma. Because one of the things that you see when you look at the risk for women is that witnessing a parent being abused by a partner actually puts women at risk of being abused.
Doctor, this is most certainly invaluable data that will assist with coming up with solutions to address the scourge. Thank you very much for joining us this evening. That's Human Sciences Research Council Director, Dr. Mpumi Zungu.